Hi everyone, my name is Ella Cox, and today I'm going to be talking about the common sleep myth, snoring is completely harmless, and why it actually isn't always harmless and can be a warning sign of a serious health condition. So, why exactly do people believe that snoring has no serious significance? Snoring is often associated with sleep, and many believe it is completely harmless. It can be seen as a simple or normal part of sleeping. Others only think that snoring becomes a problem when it is loud and disruptive to those around them. So, what exactly causes someone to snore in the first place? According to the Cleveland Clinic, snoring occurs when a blockage in your airway can cause the tissues in your nose, mouth, and throat to vibrate against each other as air passes through. The blockage may be related to your anatomy, or it may happen because of a temporary condition that causes swelling, for example, like a cold. Sometimes the muscles in your mouth and throat relax so much that they block your airways. Here I have a diagram of an open upper airway and a closed upper airway. So here in this image, it's an example of an open upper airway. These blue arrows are representing the air going through your throat, your nose and throat, and going directly to your lungs. Here, it shows how this red arrow pointing to the closed upper airway, the air becomes stopped. This is where it begins to vibrate, creating the snoring sound. Commonly in TV shows, snoring is represented as a way to show that the character is sleeping. For example, in SpongeBob and the Flintstones, these characters are sleeping, and it shows that and represents that by them snoring. Because it's so common, most people don't think to mention it or worry about it and mention it to their healthcare providers. While snoring can sometimes be harmless, research shows that persistent or loud snoring should not always be ignored. While everyone may snore at least a few times in their life, and often it's completely normal to do so, it should not always be ignored. When you snore, it can often be loud and disruptive and prevent those around you from getting and reaching their maximum sleep potential. Sleep is an incredibly important part of one's health, both physical and mental, and over time, poor sleep can be detrimental. According to the Florida ENT Associates, poor sleep can lead to memory issues, difficulty concentrating, and changes in mood, as well as putting a person at higher risk of neurodegenerative conditions such as dementia and Alzheimer's. Not only does it affect sleep quality, snoring can often be a sign of a serious health problem such as sleep apnea. According to the National Heart, Lung, and Blood Institute, loud snoring, gasping during sleep, and pauses in breathing are common signs of obstructive sleep apnea, a disorder in which breathing repeatedly stops and starts during sleep. Untreated obstructive sleep apnea has been linked to serious health problems, including high blood pressure, heart disease, stroke, excessive daytime sleepiness, and poor concentration. Although not every person who snores has sleep apnea, persistent snoring should never be dismissed without considering the possibility of an underlying condition. Snoring itself is not always dangerous, so just because you or someone around you has snored a time or two while sleeping, it doesn't call for excessive worry or calls to the doctor. However, signs that are important to take seriously are chronic, loud, or irregular snoring, especially combined with choking, gasping, or pauses in breathing, because this can indicate obstructive sleep apnea. Healthcare professionals recommend discussing these symptoms with a doctor because a sleep study may be needed to determine whether treatment is necessary. Understanding the truth about snoring can have a major impact on someone's personal health and quality of life. But many believe snoring is a normal part of sleep and just choose to ignore it. However, ignoring chronic snoring may delay the diagnosis of a serious sleep disorder. Treating sleep apnea can improve sleep quality, reduce daytime fatigue, and lower the risk of long-term health conditions. Recognizing that snoring can actually be a medical warning sign encourages people to seek help earlier and improve both their own health and the well-being of those around them. Now that we have learned why snoring should not always be dismissed as harmless, our next speaker, Abigail, will talk about the uses of technology before bed.